Welcome back to Morning Break and this month's Brain Matters segment brought to you by Gates Brain Health, where we have Dr. Gates, board-certified chiropractic neurologist and chiropractic physician who is in love with the set just like the rest of us, right?
It's amazing. So I'm really excited for you.
Yes, well, we're so excited to finally have you here, and I was telling him all of the different creative things we'll be able to do with these interviews to really give you the information in really fun and interesting ways. So without further ado, let's talk about whole body MRIs again, because one of the things that I think people don't really understand is the why they should get it. You know, if they're not feeling sick, they're not feeling under the weather, they don't feel any pain, what is still the benefit of a whole body MRI?
And kind of like I was messaging you about last night, 13 reasons to get a whole body MRI. I don't think people oftentimes think about all the organs that we can see basically in 63 minutes.
Right.
From your brain to the soft tissues of your neck, we actually see the sinuses in part. The thyroid gland.
Wow.
We see the spine, we see the liver, the pancreas, the gallbladder, kidneys, ovaries, uterus, prostate, a lot of the pelvic organs. So we see a lot of organs within the human body. We don't really see the heart, the chest and breasts as well, or the lungs, but we see these other areas. And to get a scan in 63 minutes is pretty cool.
I think that is really cool, especially when I think of, okay, so this MRI may not do the chest, heart, and lungs, but those are also the ones that are regularly checked. You know, those are the ones that we often know, but when you said the spine, I didn't even think of the spine as being an organ.
Right, exactly. And so well put. So with screening, we have so many screenings for these other conditions. Whole body MRI in many ways fills a void, in my opinion, that is not being looked at otherwise within our standard screening, as we discussed about cancers going up in younger age groups. A lot of our screenings are for people in the 5th, 6th, 7th decades, whereas people in our age bracket are not getting screened. And that's where whole body MRI can have great utility.
Absolutely. And again, it also will help you get a baseline so that you know kind of like, okay, this is, even if you do get an all clear scan, this is your baseline. You know, now you know what to compare it to if things do start to feel funny or you need to come back every year and stuff, which is really helpful. And the other thing that you were telling me that the whole body MRI is really helpful with is dementia, which is crazy. I didn't even think about it that way.
When I think we may have one side, it's of the combinostics, and combinostics gives us, I think, 13 readouts of different parts of neurological function relative to brain density. Relative to brain density, looking at the hippocampus, the memory area versus the top of the brain, so we can track patterns of dementia. We can see lesions in the brain. It's really, really cool. So many people are concerned about developing dementia. They may have a parent or a grandparent with dementia. This is a great way to get screened and say, okay, how do things look?
Now, would you say that dementia diagnoses are becoming more common, or is it just our knowledge of it that's making it much more rare?
It's a great question. No, it's becoming much more common. And the concern is that what we're seeing now is just the beginning of the tsunami.
Really?
As we live longer, all the risk factors for things like Alzheimer's are going up, pre-diabetes, diabetes. It's a real big concern.
And so even if you don't have a family history, if it is something that's on your mind, you know, why not? Just get it checked out. You have a very honest and clear policy as far as cost effectiveness of the MRIs and stuff. So if you want more information, of course, you can always go ahead and call the number there on your screen. Let's go ahead and pull up that slide. This is the whole body MRI over there. Early cancer detection, Alzheimer's, you name it. You also mentioned allergies, which is kind of perfect because I'm feeling under the weather right now because the wind is crazy. It's kicking up all of that pollen, all of that sage, whatever you're allergic to. It's a lot. And so whole body MRIs, again, helpful with that.
That's funny. And I had a unique experience recently where I was having horrible allergies and I had changed my diet, which had helped for a long time, but my allergies, I just couldn't control them until I had my air ducts looked at.
Really?
And then I had my air ducts cleaned and I'm doing so much better. I can't even tell you. Like on a day like today, I'd have to take antihistamines. I would be groggy from them. The team knows at the office, like I would have fits where I just literally could not stop sneezing all day long. And trying to see patients that way was so difficult.
I'm sure.
So we have some pictures of before and after.
Your air ducts. I mean, that's so interesting because we're always told to clean out our filters, but I can't tell you the last time anyone told me to clean out my air ducts.
And how good and I was cleaning out my filters, but it wasn't wasn't until I cleaned out the ducts.
Yeah. So a big shout out to the Air Guys LLC. You had them come on in and get you all healthy and squared away. And again, with the way the wind is kicking up everything right now, I mean, even I right now, I feel like I can't breathe through this part of my nose. So I'm a heavy mouth breather right now. It's fine. But again, all of these things that can be really helpful with MRIs, with cleaning your air ducts, all the things.
Sometimes it's simple solutions.
I love simple solutions.
That we overlook.
Exactly. Well, Dr. Gates, thank you so much for being here. We appreciate it. Thank you for taking part in our new set. We're looking forward.
And congratulations to you and the whole KOLO team. This is fantastic.
Absolutely. We're really excited. Like I said, you and I are already cooking up some really fun and creative ways to bring you our next Brain Matters segment. So we'll be sure to stay tuned for that. Thank you for being here, Dr. Gates. Thank you guys for watching. We'll be right back.